what will your party do to support rural health care to ensure the agriculture community has access to health care close to home? The Green Party.
We had a lovely debate the other day on healthcare. The point that I wanted to hammer home then, and I'd like to do it here too, is that we spend around 1%, in the vicinity of 1% on health promotion under the Canada Health Act, those monies. And we need to double that easily, maybe even push it further, so that we can continue to be, we can become healthier people. If we eat a healthier diet, then we can be healthier. Then there's more money to keep patrol the hospital open, and that's where I'd go if I was having heart pain. So I would work very hard to keep the rural health here, my own personal vested interest, but the party also supports it completely.
Thank you. The NDP?
Thank you. I'm part of the advocacy for keeping the hospital open in Petrolia. So just on a personal level, it is part of who I am and what I am doing in my spare time after I tuck my kids into bed, or sometimes give up story time to be part of that process, because it does mean a lot to me. Our party supports rural health care in every way, strengthening the Canada Health Act to include all Canadians. I would like to see, and I believe the party absolutely supports this, that the requirements for hospitals are now currently based on distance to hospitals. Of course, there are all kinds of factors involved with that. I'd like to see a change to drive time so that it does enable a hospital like we have in Petrolia to be listed as a hospital and not just a health center. I've lived in remote communities. I know what it's like to have doctors come and go every couple of weeks. I've seen what lack of access to health care can do for people, and I'm a very strong advocate for it, which is what brought me to the party. One of the main things.
Thank you. The Conservatives?
Well, certainly personally, of course, I'm extremely supportive of our local hospital, and I've worked many times, not just in this last instance with emergency room closures, but in past instances when issues were taken to the province to keep our hospital open and viable. But the Conservative government also is very supportive of rural health care. And part of our platform is to support for doctors and nurses, for partial student loan forgiveness if they agree to work in rural and remote areas. We have introduced the Mental Health Commission, which is extremely interested in working with communities such as ours. I do have a meeting set up. I did have one set up. It's on hold now with the election on, but to bring that Mental Health Commission into our community to talk about the issues that we've been having with mental health and suicides in this area. Certainly I'm working hard to obtain funding for the Petrolia Family Clinic as they try to get their clinic up and running.
Thank you. Thank you.
Sorry. Thank you. Good question. Rural health care. We here in Lambton know very well the importance of advocacy and engagement to make sure that we keep rural health care viable and sustainable, and the fact that we absolutely need the CEE hospital. We as the Liberal Party recognize the challenges that municipalities are finding in local health care delivery is finding to make sure that there's doctors, nurses, and nurse practitioners. And we will forgive student loan debt, up to $20,000 for each student that becomes a doctor, a nurse practitioner who wants to serve in a remote and rural area. That's fundamental to make sure that we have access. We also believe that the prevention side, and that's part of our national food policy when we talk about education, nutritional values, standards of our food and our trans fats and our sodiums and our sugars, and we're also talking about labeling. So it's about information, education, and ensuring that we have the recruitments and the ability to recruit good doctors, nurses, and nurse practitioners. Thank you.